Hello, my name is Sharon Zilberman. I'm the Executive Vice President at Apple Insurance, located in Boca Raton. We are your local Florida Blue agency. And with me today is my colleague and friend, Stacy Jaffe, a senior licensed agent with Apple Insurance and Florida Blue. Today, we're here to talk about Florida Blue, Medicare, and really review with our viewers the differences between the different types of Medicare choices that you have. Hi, Stacy.
Hi, Sharon. Thank you for having me.
Well, I do want to just mention that Stacy is not only our top agent at Apple Insurance, but also is in the top 30 of Florida Blues agents all over the state of Florida. So it's really great to have a conversation with you about questions that you typically hear with your clients.
Thank you.
Stacy, one of the things that my clients and prospects are always asking is, how do you choose the right plan, the right Medicare coverage for themselves? What should a member or a prospect look for?
Medicare, Sharon, is a very confusing topic. So when somebody asks me, how do I choose a Medicare plan? I explain to them that we need to get back to the basics. Original Medicare is comprised of Part A, which is hospitalization, and Part B, which is doctor visits, diagnostic testing, and lab work.
Stacy, that's what's on your red, white, and blue card, right? That you get from the government?
That is correct. So your red, white, and blue card, which is your Medicare claim card, will be comprised of your name, your Medicare number, your date for Part A, and your date for Part B.
Stacy, original Medicare Parts A and B, can you tell us what that covers, or more importantly, what you tell our clients what it doesn't cover?
Absolutely, Sharon. Part A is hospitalization, and there is no premium, but the member does have to pay a deductible. Part B does have a premium, $148.50 a month. Part B covers medical, doctor visits, diagnostic testing, and lab work. There is also, with Part B, the member pays 20%, Medicare covers 80%. So it does leave a lot of holes still unfilled for the member.
Oh, so maybe there are other options. And this is what I tell my clients. Do you tell your clients? What are some of their other options to go for instead of just original Medicare?
Absolutely. There are other options. There is a supplement, and a supplement works hand in hand with original Medicare. Whatever the supplement does not cover, original Medicare picks up and covers. If somebody goes with original Medicare or a supplement, they do have to purchase a standalone drug plan. The other option is a Medigap plan, also known as a Medicare Advantage plan. A Medicare Advantage plan is going to cover Part A, hospitalization, Part B, the doctor visits, diagnostic testing, lab work. It also covers Part D included in it. Many Medicare Advantage plans are a zero premium. So just to recap, it covers Part A, Part B, Part D, and Part C is the Medigap plan that ties it all together. The other advantage, Sharon, for a member to go with a Medicare Advantage plan is that it's going to cover many ancillary extra benefits that you will not get with original Medicare and you will not get with a supplement. Some of those extra benefits are dental, vision, hearing, silver sneakers, over-the-counter pharmacy benefits, as well as transportation.
That's great to understand. You know, an analogy that I use many, many times with my prospects and people that I'm talking to differentiate between what a supplement is and what a Medicare Advantage is in a restaurant. If you were to go to a buffet, and let's say that it was a fancy buffet and it was an all-inclusive and it would cost about $75 a person to go to the buffet, you are going to pay that even if you're like me and you're always on a diet, even if you don't eat the cakes and the desserts, you can't say to the maitre d', oh, I'm not eating those things, so don't charge that for me this time. Whereas, so it's like going to the buffet. On a supplement, you're going to pay that premium every month, regardless of whether you use the plan. But on an Advantage plan, it's like going into a restaurant and ordering a la carte. If you want an appetizer, you pay for the appetizer. If you want the coffee, you get a cup of coffee. If you want an alcoholic beverage, you're going to order everything a la carte, and you're only paying for what you use. So depending on if you're a high user or a low user of your medical coverage, it can be more cost effective. And that's really what I tell my agent, what I tell not only my agents, but also I tell my clients, you have to do that type of evaluation.
Absolutely. So a supplement, you're going to pay for your premium on the supplement, you're going to pay for the drug plan, you're going to pay for your Part B in the original Medicare. You're paying for three things on a monthly basis. It can become very costly.
Excellent. I just want to mention many people who come to Florida start off working, and they may be working. The rules change a little bit if you are working. So if you are 65 or you're turning 65 and you are working, our best advice to you is to speak to your human resource manager. Find out if the company requires you to purchase Part B. Some do and some don't. Regardless, just file this. I want our viewers to really understand that if you are working and you do not take Part B when you first become eligible for it, you will be able to purchase it after you leave your job, as long as you do that within a specific time period. So it's important for you to remember that if you are working, once you leave that job, you do need to apply for your Part B in a timely manner. And you know what, Stacy, that reminds me, I just had a case this morning where the person has been on Social Security disability. They've been on it for 2 years, and now they're eligible to get their Medicare Part A and B. A, of course, was automatic, but the Part B, they had to wait their waiting period in order to get it. So there will be circumstances where somebody is under 65 on Medicare, either due to a disability or possibly due to end-stage renal disease, where you do need to go ahead and take and enroll into your Medicare plan. The best way to do it is to check on Medicare.gov, or you can call us and we could advise you on how to do it.
So Sharon, let me ask you, what are some special enrollment periods that people have with Medicare?
Okay, so that's a really good question, and I just want to discuss, there are two different types of enrollments that we're talking about. The first time that you enroll in Medicare, that is your Medicare enrollment. That is your original Medicare that you were referring to as Part A and Part B. That, as we just discussed, you get approximately 3 to 6 months before you turn 65. However, you can enroll into a Medicare supplement or a Medicare Advantage plan at certain times. The initial time is 3 months before your birthday, the month of your birthday, or 3 months after your birthday. I want members and prospects out there in our viewership to understand that it begins the first of the month on your birthday, your Medicare, unless you were lucky enough to be born on the first of the month, and then it's the previous month, the month preceding your birthday, that you become eligible. Once you're eligible for your Medicare, you can enroll in a Medicare Advantage plan anytime 3 months before your birthday, the month of your birthday, or 3 months after your birthday. That is called your initial enrollment period. Everybody can make a change on their plan. during the annual enrollment period, which goes every year from October 15th through December 7th.
That's great information, Sharon. Thank you for sharing that. I have a question. A lot of my clients tend to ask me, what if I cannot afford the Part B premium? How do they get extra help with that?
You know what? What's really surprising is how many people actually qualify for extra help. So there are two things that you could become eligible for based on your income. One would be Medicare, Medicaid, where on Medicaid, your Part B premium is paid for you. And the other is extra help with prescriptions. One of the things that I absolutely love about Florida Blue is we have a whole department that all they do is check eligibility for Medicaid and also for extra help for your prescriptions. So instead of going and trying to do it yourself, we can help you do it.
It is a fabulous department. We as agents need to sign the member up for what they're currently eligible for, but instead of the member having to go to Medicaid and apply themselves, we submit in their application to our DSNP department. They will reach out to the member and they do the interview and they get back to them right away. So it really alleviates the burden of somebody having to go through this entire process all on their own.
I really appreciate that. Medicare can be so confusing. Your choices can be so confusing. And you know, I just was reminded of a client, a prospect, actually not a client yet, who just yesterday called me up and said, okay, sign me up for a plan. I just moved here from Florida. From New York, actually, to Florida. And I just wanted to mention, as we're talking about all of these things, when somebody moves from another state or outside of their existing service area, that means that they'll be entitled to a special enrollment. That's going to be very important if they moved, or if, as we were just talking about, the Medicare or Medicaid program, if you become eligible, you're also entitled to a special enrollment. So don't think that the only time that you can make a change is in the annual enrollment period. When in doubt, just call us and we'll answer your questions.
Sharon, I want to touch on another confusing topic. A lot of my clients are always asking me, Stacy, what is the difference between an HMO and a PPO? So I just want to take a minute to explain this to our viewers. An HMO is a health maintenance organization, and a PPO is a preferred provider organization. The main differences between an HMO and a PPO is that on an HMO, you do need referrals from your primary doctor to see a specialist, and you have to stay within the network of doctors, network of hospitals. On a PPO, you have the flexibility of going in or out of network, and you do not need a referral to see your primary doctor. What's so wonderful about Florida Blue is that we do not dictate to our members that they must stay within their county to see a doctor or a hospital. They can ask their primary doctor to see a doctor in another part of the state, providing that they are in that HMO network. The other thing I want to mention, Sharon, which I'm sure you get this a lot with your clients as well, a lot of people feel that an HMO is restrictive or that it's stressful. Why should I have to go to my primary doctor first to go to a specialist? And I really want to touch on a personal experience. The reason why is your primary doctor helps you navigate your health plan. I had a client call me the other day. He banged his foot. And he said, oh, it didn't hurt, but days later it blew up. It was really black and blue. And he's trying to self-medicate himself. I think I'm going to go to a podiatrist. Who do you recommend? And I said, no, you need to go to your primary doctor. Let your primary doctor examine your foot. You might need an orthopedist, not a podiatrist. Let a medical professional tell you, guide you, and navigate you on what you need. They're your partner in your health. So it's somebody you could confer to, go to that specialist, come back to the primary doctor, and have the conversation of if it worked or if you still need to go somewhere else.
You know, I love that, Stacy, because so often, even our members who are on a PPO, Medicare Advantage plan, or on a supplement plan that have no network restrictions, they will often start off and ask their primary doctor, who do you recommend?
So true.
So don't get, I always say, keep an open mind in the process. Yes, an HMO does require a referral, but consider a referral the ability to substitute that word with maybe recommendation. Who do you recommend that I'm going to see? However, the referral, part of the reasons why HMOs have lower costs associated with them is because somebody is assisting you in managing your care. They're keeping you from having unnecessary tests, unnecessary costs, and it's not to restrict you, it's to enhance what you're getting out of the Medicare plan that you choose.
So when choosing to go with an HMO or PPO, you really have to evaluate your lifestyle. Are you a snowbird? Do you still travel? Do you live half the year in one part of the country and half the year in Florida? If that's the case, yes, then maybe a PPO is right for you. If you're someone that sticks within a 5-mile radius of your zip code, then an HMO is probably better for you. Both of them come with wonderful extra benefits. Sharon, are you able to elaborate on some of these extra benefits that come with our Medicare plans?
Our Medicare Advantage plans, depending on which one you take, has all different extra benefits. Some have dental, either preventative or comprehensive dental. We have vision plans that also help cover the cost of your glasses or your contact lenses. We have hearing, which helps cover the cost of your hearing aids, transportation to and from the doctors on specific plans. And we have a new program that we are so proud to introduce, and that is called our Papa Home Care Provider Plans. These plans allow members to have 60 hours of somebody coming in and assisting them with activities of daily living. These can be things like light housekeeping. It could be showing you how to use your computer, the technology, so that you can speak to your grandchildren via Zoom. It could be just companionship. The person can go out with you for grocery shopping. We are very, very proud that at no cost to you, we have the Papa benefit available. It is a South Florida company, and we're really pleased to be offering it to our members.
I also want to touch on that our plans offer silver sneakers. And it's very important for 65 and older members to really take advantage of exercise. Bones could get brittle, they could get stiff. This type of program was instilled not to go to the gym and become a bodybuilder at 65 or older, but really for your cardiovascular health, your mental health, the happy endorphins it's going to put into your head. And I see with a lot of my clients, the ones that utilize the silver sneakers, overall health, mental health, they're so happy.
I think that with Florida Blue, we want to be a partner in your health. That's really the philosophy of Florida Blue to begin with. Even in things like assisting you in purchasing vitamins and different household items in our over-the-counter benefits on our plans.
Sharon, a lot of my clients ask me about an over-the-counter pharmacy benefit. Are you able to elaborate on this?
Yes, so in addition to all of the extra benefits that we discussed before, we have on most of our plans an over-the-counter benefit. This is the opportunity for a member to order from a catalog a specific amount of items. It could be anything from vitamins, it could be Band-Aids, it could be toothpaste, just things that are in your household, just an extra way of purchasing those items.
So anything you would purchase at a regular pharmacy, you could order.
Well, not your
correct?
medications. Of course, the medications have to be done at the pharmacy,
the
but
over-the-counter.
anything like if you needed vitamin D or if you needed folic acid is another one that we offer over the counter. But some people even use it. They replace their toothbrush every 3 months, like the American Dental Association says to do. Or they'll get some aspirin or household items that they need. Some people prefer to use a emergency response so that they get an emergency response where they can press a button and the person can alert other people that they're in danger or in a problem. So they get a catalog and they can review through it and look and see what is important to them and to their family in order to get it.
That's fabulous. In addition, I just want to add that we have our Healthy Rewards program. It's a great program because we're rewarding our members for doing preventative care that they should be doing anyway to stay healthy. So once somebody becomes a Florida Blue member, they could sign up with Healthy Rewards online or calling on the phone, and Healthy Rewards will track them. If somebody goes for a physical, we're going to reward them with a gift card. If they get a flu shot, again, we're going to reward them, or a colonoscopy. So our members can gain up to $190 back in gift cards, and they get to choose where they want it from: Publix, Target, Walmart, department stores. It's really a great way. It's a win-win for keeping our members healthy, yet rewarding them.
That's fantastic. I think that's called the Florida Blue Medicare Healthy Rewards. I love this program. It doesn't cost you anything to enroll, and you're doing these things anyway. So why not get rewarded for that?
Absolutely.
Stacey, we've talked about a lot of different things. We
We
talked about original Medicare, we talked about Medicare supplements, we talked about Medicare Advantage plans, when you can enroll in Medicare, when you can enroll inside of a plan, and we talked about the enrollment timelines and a few of the things that members should look out for. I'm going to bring it back to what our original question was. How do I choose a Medicare plan for me that's right for me, or really right for your parent, for your sister? How does somebody really, can we wrap it all together and really determine what the best way to go is?
The best way to go is for a member to reach out to a trusted advisor, licensed agent, who will sit down and go over what are your wants, needs, medical conditions, who are your doctors, who are your go-to hospitals. We're going to check our provider directory, make sure your doctors and hospitals are in the provider directory. We will go over your medications, make sure that they're in the drug formulary, give you the tier and the price. And we're going to discuss budget, lifestyle, and all those options to determine the best plan for our members.
One thing that I try, and thank you for that, that is not an easy feat. It does take a long time. We are in the relationship building component. But let's say my husband aged into Medicare a couple of years before me, and he's on a plan. Should I automatically go on that plan that he's on?
Absolutely not. What's even right for one spouse may not be right for another spouse. It's very individualized.
So really, members and viewers, what we're saying is take the time to evaluate and see what's important to you, work with an agent, and therefore we can help you make a logical and informed decision.
Sharon, I want to make sure our members know working with an agent is no cost to the member. It's complimentary, and we can give you a very good education.
That's really important because it's not only when you first initially sign up for a plan. We would love it if every Floridian signed up with us right when they turn 65. But again, because you get a choice each year in the annual enrollment, we recommend doing an assessment to see if the plan that you are currently on meets your current needs. One thing that I usually look at with our clients is there are many people who move here who are on a supplement. It's costing them a lot of money, and when they move here, now they're just staying right in their local area. And so that's where you have some opportunity to evaluate, analyze, and really make a good decision for you. And you get to make that decision each year. Stacy, how should we contact you?
If anybody in this viewing area is interested in speaking with myself or one of the agents here, please call us at 954-505-8641.
Additionally, everything that we spoke about today, we do have in a PowerPoint presentation. If you wanted a copy so that it was clearer to you, maybe there was something that you heard that you would like further elaboration on, please send an email to questions@appleinsurance.com, and we will be happy to send it out to you and give you that information. Thank you so much, Stacy, for joining us. You're a wealth of knowledge. I can understand why you're a top agent with Florida Blue. Thank you for spending some time with Apple Insurance, your local Florida Blue agency.
It was my pleasure.